Now, the Board of Healthcare Funders, or BHF, which represents 64 medical aid schemes across the continent, say that they are concerned about the sustainability of the industry as it grapples with the impact of COVID-19 during this period. BHF compiled research on a range of issues pertinent to medical aid schemes, and financial sustainability is at the center of the difficulties based on the projections and an upsurge in coronavirus infections. Now, questions of sustainability in respect of healthcare expenditure, retention of membership, matters related to fraud and waste are just some of the challenges highlighted. Furthermore, there's also a decline of over 50% in the utilisation of health services due to a decline in hospital admissions. Charlton Murove, who is the head of research at the Board of Healthcare Funders, joins us now via Zoom to talk about this. And thanks so much for your time this morning.
Thank you for having me, Sakina, and good morning to the viewers.
Now, Charlton, given the concern that medical aid companies might not be able to sustain themselves in this COVID period, how much do the schemes under BHF normally collect on an annual basis?
Yeah, so on an annual basis, all the schemes in South Africa collect about 180 billion through contributions from beneficiaries of medical schemes. Maybe about half of that is attributed to the schemes that belong to the Board of Healthcare Funders.
Now, looking at the current situation, are you able to make a comparison that would give a perspective when looking at current costs and, of course, costs from previous financial years at around the same time?
It's been a bit difficult, as you have highlighted earlier on, that we've seen a drop in utilization, less hospital admissions, less beneficiaries going to visit their practitioners for care. So obviously there is a temporary decline in terms of what is being spent by schemes. But as the virus is spreading, we'll expect to see much higher utilization, more people being admitted in hospital, length of hospital increasing. And then a new dynamic which the virus has brought is the requirement for testing. There are instances where beneficiaries have to be tested several times. So that all adds up in terms of the costs. So as we approach the peak, it's a bit uncertain as to how much the industry will end up spending in claims related to COVID-19. And then over time, there might be some beneficiaries who are deferring treatment for the care that they need. And that deferred treatment might end up leading to much higher claims when things normalize. So the uncertainties are real and they are there. It's very difficult to tell how everything will shape up at the end of the pandemic.
So as things stand right now, are there any significant losses that any of the medical aid schemes have incurred?
At this stage, I wouldn't expect that there would be many because of the lower utilization. I think probably the greatest challenge the schemes would have is related to what has happened in the economy as a result of the lockdown. So contribution revenue is threatened. If there are job losses, then contribution revenue will also decline in the foreseeable future. So if you look at what has happened historically, the greatest risks are coming from what has happened in the economy. In the future, it's more likely to be risks which will be related to actual healthcare expenditure, as well as what the economic impact would be on the schemes.
So, Charlton, under normal circumstances, I would imagine that members don't utilize all their funding allocation. So what normally happens to the unused funds that have already been allocated?
So under normal circumstances, yes, not all is utilized, but what you normally find is that schemes generally survive on contribution revenue. Claims ratio across our industry is just under 90%, which means that most of the money which is collected from beneficiaries is actually used to pay for healthcare expenditure. So that delicate balance must always be maintained so that the industry is sustainable.
So one would imagine that the unused funds would come in handy at a time like this, and it would be able to carry the scheme since you said there aren't many admissions, for example, at this time. So is that not the case?
Yes, we do see that when it comes to potential or estimated claims that will be coming through as a result of COVID, schemes will be able to sustain that. The question has really been around the long-term sustainability. The industry has reserves which are above 30% of contribution revenue. So in terms of claims for COVID-19, that should really be enough to cover those expenditures. But then these reserves taken up, I would estimate you need more than 5%, 5 years to build up to 30% of reserves. So if those reserves are wiped out and the economy is not doing well, schemes will not have enough contribution revenue. It will take a very long time for the industry to get back to the position that it finds itself in at the moment.
In terms of what exactly? In terms of the profit margins or how else?
So contributions are paid. Expenditure is paid out of those contributions, and then whatever is left over is left to go to the reserves. So it takes a bit of time for schemes to build up long-term reserves. Like I said, if you want to get up to 30% of contribution revenue, you need more than 5 years to build it up. Otherwise, it becomes too expensive in terms of contributions for the members. So the reserves are there for times like this, but they should still be managed in a very delicate way to ensure that the industry becomes sustainable in a long time, as they take a long time to build up.
But you almost make it sound as though those reserves shouldn't be touched, but you also say that they are there for times like these. In your newsletter, Charlton, you say that in order to address COVID-19 effectively, it will require legal changes in respect of reimbursements. What exactly does that mean?
Yeah, so there are instances where you have some restricted schemes where schemes are actually set up by certain employers to look after their employees and their dependents. And then there are instances where certain companies could not function due to the lockdown, and they actually needed to look at ways of using accumulated reserves so that they can almost subsidize contribution revenue for the employees. So when the reserves are available, they must be used for instances like that. And the regulations are not as flexible in terms of allowing employers and beneficiaries not to pay contributions. So there are some instances where the employers had to go and look for maybe rule amendments or try to get exemptions, for instance, to allow the flexibility in the use of resources, in the use of the reserves. So yes, the reserves exist for this time. And they must be used to assist the members as much as possible. And it still must be done in a responsible way because the reserves are not a bottomless pit. So we found that the industry actually was very innovative in terms of how they managed to utilize reserves. There are instances where they would give targeted contribution holidays. In some instances, they actually allowed members to buy down to lower options, which is not normally allowed. And the whole idea was trying to keep as many of the beneficiaries covered as far as possible.
And just a final one, many people losing their jobs during COVID-19 and unable to pay their contributions, and they've been told that they would actually lose their funds. So what is the situation there, and why are the medical aid schemes seemingly not, receptive to the difficulty that their members are going through at the moment?
It's the medical schemes have been as supportive as is possible, subject to obviously the regulatory constraints. And then the difficulty in which medical schemes find themselves in is the amount of money that they have is what members contribute. And then there's also a very thin line between what schemes receive in contributions and what they pay out in claims. Like I was saying, that the claims ratio is just under 90%. So if schemes do not receive that contribution revenue, they will not be able to pay for claims. The reserves, they only provide cover of only about 3 months. So if a scheme has got 25% reserves, for instance, it can only pay claims for the next 3 months if it is not receiving any contributions. So it's not really possible for a scheme to be generous and allow a lot of free play in terms of allowing members to receive access to care while they are not receiving any revenue. So the way the schemes went about it, it was in a measured approach. In instances where they could see certain individuals were really struggling, then they could hand a helping hand. But a blanket exemption from contributions would almost bankrupt a scheme in the instance that I was explaining. So as far as possible, we found that the schemes were really trying to support the members. It's just that they are also constrained by their inability to have an income other than member contributions.
Well, thank you so much, Charlton Murove, a research head at the Board of Healthcare Funders, discussing the state of medical aids with us during COVID-19. And very clear there, the schemes do not exist to be philanthropic. Let's get over to the news.